Introduction to Pathophysiology. Pathophysiology is the study of how disease processes affect the normal functioning of the body. It bridges the gap between basic anatomy and physiology and clinical medicine, explaining the functional changes associated with disease and injury. Understanding these mechanisms is crucial for diagnosing, treating, and preventing illnesses effectively. This field examines the causes, mechanisms, and manifestations of disease at molecular, cellular, tissue, organ, and systemic levels. It helps healthcare professionals predict the course of a disease and the potential outcomes of various interventions. By focusing on the why and how of disease, pathophysiology provides a foundational understanding for clinical practice. The scope of pathophysiology is vast, encompassing a wide range of conditions from infectious diseases to genetic disorders and chronic illnesses. It explores how external factors like pathogens or toxins and internal factors such as genetic predispositions or immune dysregulation contribute to disease development. This discipline also investigates the body's compensatory mechanisms and adaptive responses to stress and injury. A solid grasp of pathophysiological principles is essential for interpreting diagnostic tests, understanding drug actions, and developing effective patient care plans. It forms the intellectual backbone for many medical and allied health sciences. Cellular basis of disease. All diseases ultimately originate at the cellular level, making cellular pathology a cornerstone of pathophysiology. Cells are the fundamental units of life, and their proper functioning is essential for tissue and organ integrity. When cells are exposed to stress or injury, they can undergo various changes that lead to disease. These changes might include alterations in cell structure, metabolism, or genetic material. Understanding these cellular responses helps explain the initial events that trigger a disease process. For example, damage to mitochondrial function can impair energy production, leading to cell dysfunction or death. The health of an organism is a direct reflection of the health of its constituent cells. Cellular components such as the nucleus, mitochondria, endoplasmic reticulum, and cell membrane each play critical roles in maintaining cellular homeostasis. Damage to any of these organelles can have profound effects on cell viability and function. For instance, lysosomal enzyme deficiencies can lead to the accumulation of toxic substances within the cell, causing storage diseases. Similarly, mutations in DNA can disrupt protein synthesis, leading to genetic disorders or cancer. Pathophysiology explores how these specific cellular derangements contribute to the broader clinical manifestations of disease. It emphasizes that disease is often a cascade of events initiated by cellular insults. Homeostasis and allostasis. Homeostasis refers to the body's ability to maintain a stable internal environment despite external changes. This dynamic equilibrium is crucial for survival, involving constant adjustments of physiological parameters like temperature, pH, blood glucose, and blood pressure. Regulatory systems, often involving negative feedback loops, work to bring these parameters back to their set points when they deviate. For example, if body temperature rises, sweating and vasodilation occur to cool the body down. Pathophysiology often involves a failure or disruption of these homeostatic mechanisms, leading to disease states. Understanding normal homeostatic ranges is vital for recognizing when the body is in distress. Allostasis, a more recent concept, describes the process by which the body achieves stability through physiological or behavioral change. Unlike homeostasis, which aims for a fixed set point, allostasis involves adapting to new challenges by adjusting set points. For instance, during prolonged stress, the body might maintain elevated cortisol levels to cope, which is an allostatic response. While beneficial in the short term, chronic allostatic load, or the wear and tear on the body from repeated or prolonged stress responses, can lead to various diseases. Pathophysiology examines how both failed homeostasis and excessive allostatic load contribute to the development and progression of illness. Etiology and pathogenesis. Etiology refers to the cause or origin of a disease. Diseases can have diverse etiologies, including genetic factors, infectious agents like bacteria or viruses, environmental exposures such as toxins or radiation, nutritional deficiencies or excesses, and immunological dysfunctions. Sometimes a disease may have multiple contributing factors, making its etiology multifactorial. For example, heart disease often involves genetic predisposition, lifestyle choices, and environmental influences. Identifying the etiology is the first crucial step in understanding a disease and developing targeted interventions. Without knowing the cause, effective treatment is often difficult or impossible, highlighting the importance of thorough diagnostic investigation. Pathogenesis describes the sequence of cellular, biochemical, and molecular events that occur from the initial exposure to an etiologic agent until the ultimate expression of the disease. It explains how the disease develops and progresses. For instance, in an infection, pathogenesis would detail how a pathogen invades the body, replicates, causes cellular damage, and triggers an immune response, leading to symptoms. Understanding pathogenesis allows for the identification of critical points in the disease process where therapeutic interventions can be most effective. It helps explain why certain symptoms appear and how the disease affects different organ systems over time, providing a roadmap for disease management. Cellular stress and injury. Cells are constantly exposed to various stresses, both internal and external, that can lead to injury. These stresses include hypoxia, lack of oxygen, physical agents like trauma or extreme temperatures, chemical agents such as toxins or drugs, infectious agents, immunological reactions, and nutritional imbalances. The cell's response to stress depends on the type, duration, and severity of the stressor, as well as the cell's own adaptability and metabolic state. Mild, transient stress might trigger adaptive responses, allowing the cell to survive and maintain function. However, severe or prolonged stress can overwhelm the cell's adaptive capacity, leading to irreversible injury and cell death. Understanding these thresholds is critical. Cellular injury manifests through a variety of morphological and functional changes. Common cellular responses to injury include swelling, accumulation of intracellular substances, and changes in membrane permeability. For instance, hypoxia impairs oxidative phosphorylation, leading to decreased ATP production, which then disrupts ion pumps and causes cellular swelling. If the injury is persistent or severe, it can lead to irreversible damage, characterized by profound mitochondrial dysfunction and disturbances in membrane integrity. These changes are often visible under a microscope and serve as diagnostic indicators of disease. Pathophysiology investigates the specific molecular pathways involved in these injury responses. Mechanisms of cell death. Cell death is a fundamental process in both normal development and disease. There are two primary mechanisms: necrosis and apoptosis. Necrosis is typically a pathological process occurring when cells are exposed to severe injury, such as ischemia or toxins. It is characterized by cell swelling, rupture of the cell membrane, and leakage of cellular contents, which triggers an inflammatory response in the surrounding tissue. This uncontrolled form of cell death is often detrimental to the organism, contributing to tissue damage and organ dysfunction. Understanding the triggers and morphological features of necrosis is crucial for diagnosing acute injuries. Apoptosis, or programmed cell death, is a highly regulated and energy-dependent process. It plays a vital role in normal physiological processes, such as embryonic development, tissue homeostasis, and the elimination of potentially harmful cells like those infected by viruses or with DNA damage. Unlike necrosis, apoptosis involves cell shrinkage, chromatin condensation, and fragmentation into apoptotic bodies, which are then efficiently phagocytosed by neighboring cells without eliciting an inflammatory response. Dysregulation of apoptosis can contribute to various diseases, including cancer, too little apoptosis, and neurodegenerative disorders, too much apoptosis. Pathophysiology differentiates these mechanisms to understand disease progression. Cellular adaptations. When cells are exposed to chronic stress, they can undergo various adaptive changes to cope with the altered environment and maintain viability. These adaptations allow cells to adjust their structure and function to better withstand the stressor, often by altering their growth and differentiation. Common cellular adaptations include atrophy, hypertrophy, hyperplasia, metaplasia, and dysplasia. These responses are generally reversible if the stress is removed, but prolonged or severe stress can lead to irreversible injury. Understanding these adaptive mechanisms is crucial for distinguishing between normal physiological responses and early pathological changes. They represent the cell's attempt to achieve a new steady state. Atrophy is a decrease in cell size and number, leading to reduced organ size, often due to disuse or decreased nutrition. Hypertrophy is an increase in cell size, resulting in an enlarged organ, commonly seen in muscle cells responding to increased workload. Hyperplasia is an increase in the number of cells, often in response to hormonal stimulation or chronic irritation. Metaplasia involves the reversible replacement of one mature cell type by another, usually better suited to withstand a particular stress. Dysplasia refers to disordered cellular growth, characterized by variations in cell size, shape, and organization, often considered a precursor to neoplasia. Pathophysiology examines the mechanisms and clinical significance of each of these adaptations. Inflammation, acute response. Inflammation is a vital protective response of vascularized tissues to injury or infection. Its primary goal is to eliminate the initial cause of cell injury, clear out necrotic cells and tissues, and initiate the process of repair. Acute inflammation is the immediate and early response to injury, characterized by rapid onset and short duration, lasting from minutes to a few days. The cardinal signs of acute inflammation are redness, rubor, swelling, tumor, heat, calor, pain, dolor, and loss of function, functio laser. These signs are a direct result of the vascular and cellular events occurring at the site of injury. Understanding these initial responses is fundamental to understanding disease. The key events in acute inflammation involve changes in blood vessels and the migration of leukocytes, primarily neutrophils, to the site of injury. Initially, there is vasodilation, leading to increased blood flow and causing redness and heat. This is followed by increased vascular permeability, allowing fluid and plasma proteins to leak into the extravascular tissue, resulting in swelling. Leukocytes then adhere to the endothelial lining of blood vessels, emigrate into the interstitial tissue, and are activated to phagocytose pathogens and cellular debris. Chemical mediators, such as histamine and prostaglandins, orchestrate these complex events, contributing to pain and the overall inflammatory response. Pathophysiology details these intricate cellular and molecular interactions. Inflammation, chronic response. Chronic inflammation is a prolonged inflammatory response, lasting weeks, months, or even years, where active inflammation, tissue injury, and attempts at repair coexist simultaneously. It often occurs when the acute inflammatory response fails to eliminate the injurious agent, or when there is persistent exposure to certain stimuli. Unlike acute inflammation, which is dominated by neutrophils, chronic inflammation is characterized by the infiltration of mononuclear cells, including macrophages, lymphocytes, and plasma cells. It is a major component of many debilitating diseases, such as autoimmune disorders, atherosclerosis, and chronic lung diseases. Understanding its persistence is key. The mechanisms of chronic inflammation involve a complex interplay of immune cells and chemical mediators. Macrophages play a central role, not only in phagocytosis, but also in secreting growth factors and cytokines that promote fibrosis and angiogenesis, new blood vessel formation. Lymphocytes contribute to the immune response, and their sustained activation can lead to tissue damage. Granulomatous inflammation is a specific type of chronic inflammation characterized by aggregates of activated macrophages, often seen in diseases like tuberculosis. Chronic inflammation can lead to significant tissue destruction, fibrosis, and loss of organ function, highlighting its pathological importance. Pathophysiology explores the long-term consequences of this sustained response. Tissue repair and regeneration following injury. The body initiates processes of tissue repair and regeneration to restore structural integrity and function. Tissue repair involves the replacement of damaged tissue with fibrous connective tissue, leading to scar formation. This process is essential when the injured tissue cannot fully regenerate or when the injury is severe. Regeneration, on the other hand, involves the complete restoration of the original tissue structure and function by proliferation of residual cells and maturation of tissue stem cells. The capacity for regeneration varies greatly among different tissues. For example, the liver has a high regenerative capacity, while the heart has a very limited one. Pathophysiology examines the factors influencing these outcomes. The process of tissue repair involves several overlapping phases, including inflammation, proliferation, and remodeling. During the proliferative phase, fibroblasts migrate to the injury site, proliferate, and synthesize extracellular matrix components like collagen, forming granulation tissue. Angiogenesis, the formation of new blood vessels, is also prominent during this phase, providing nutrients and oxygen for healing. The remodeling phase involves the reorganization of the collagen fibers, leading to the maturation and strengthening of the scar. Factors such as infection, poor nutrition, and certain medical conditions can impair these healing processes, leading to delayed or abnormal repair. Understanding these phases is crucial for promoting optimal healing. Wound healing processes. Wound healing is a specific and complex example of tissue repair, involving a series of overlapping phases: hemostasis, inflammation, proliferation, and remodeling. Hemostasis, the immediate response, involves vasoconstriction and platelet plug formation to stop bleeding, followed by coagulation to form a fibrin clot. This initial clot not only prevents blood loss, but also provides a provisional matrix for migrating cells. The inflammatory phase then clears debris and pathogens, preparing the wound for subsequent repair. Effective hemostasis is critical for creating a stable environment for the later stages of healing. Any disruption in this early phase can significantly impede the entire healing process. The proliferative phase focuses on filling the wound and covering the surface. This involves angiogenesis to form new blood vessels, fibroplasia to synthesize collagen and extracellular matrix, and epithelialization, where epithelial cells migrate and proliferate to cover the wound surface. Wound contraction, mediated by myofibroblasts, also occurs to reduce the size of the defect. Finally, the remodeling phase involves the maturation of the collagen fibers, increasing the tensile strength of the scar tissue over months to years. Pathophysiology examines how factors like infection, nutrition, age, and chronic diseases can impair these delicate processes, leading to complications like chronic wounds or excessive scarring. Immune system overview. The immune system is a complex network of cells, tissues, and organs that work together to protect the body from harmful substances, such as pathogens, toxins, and cancerous cells. It can distinguish between self and non-self, mounting a targeted response against invaders while tolerating the body's own components. The immune system is broadly divided into two main branches: innate immunity and adaptive immunity. Both branches are essential for a comprehensive defense, and their coordinated action ensures effective protection. A healthy immune system is vital for maintaining overall health and preventing disease. Dysfunctions in this system are central to many pathophysiological conditions. Innate immunity provides the first line of defense, acting rapidly and non-specifically against a wide range of pathogens. It includes physical barriers, like skin and mucous membranes, as well as cellular components, such as phagocytes, macrophages, neutrophils, and natural killer cells. Adaptive immunity, also known as acquired immunity, is more specific and develops over time after exposure to a particular antigen. It involves lymphocytes, B cells, and T cells, and has a memory component, allowing for a faster and stronger response upon subsequent exposure to the same pathogen. Pathophysiology explores how these intricate systems can be compromised or overactive, leading to various immune-mediated diseases. Hypersensitivity reactions. Hypersensitivity reactions are exaggerated or inappropriate immune responses that cause tissue damage and disease. While the immune system normally protects the body, in hypersensitivity, it overreacts to harmless substances or self-antigens. These reactions are classified into 4 main types: type 1, 2, 3, and 4, based on the immune mechanisms involved and the speed of the reaction. Understanding these classifications is crucial for diagnosing and managing allergic reactions, autoimmune diseases, and other immune-mediated disorders. Each type presents with distinct clinical manifestations and requires specific therapeutic approaches. Pathophysiology details the specific immune pathways leading to these damaging responses. Type 1 hypersensitivity, or immediate hypersensitivity, involves IgE antibodies and mast cell degranulation, leading to conditions like allergies and anaphylaxis. Type 2 hypersensitivity involves IgG or IgM antibodies binding to cell surface antigens, causing cell lysis or dysfunction, as seen in transfusion reactions or autoimmune hemolytic anemia. Type 3 hypersensitivity involves immune complex formation, antigen-antibody complexes that deposit in tissues, triggering inflammation and damage, exemplified by serum sickness or lupus nephritis. Type 4 hypersensitivity, or delayed type hypersensitivity, is T-cell mediated and takes 24 to 72 hours to develop, observed in contact dermatitis or tuberculosis skin tests. Each type has a unique pathogenesis. Autoimmune disorders. Autoimmune disorders occur when the immune system mistakenly attacks the body's own healthy tissues, failing to distinguish between self and non-self antigens. This loss of self-tolerance leads to chronic inflammation and tissue damage in various organs. The exact causes of autoimmunity are often multifactorial, involving a combination of genetic predispositions and environmental triggers, such as infections or exposure to certain chemicals. These conditions can affect almost any organ system, leading to a wide spectrum of clinical manifestations, from localized inflammation to widespread systemic disease. Understanding the breakdown of self-tolerance is central to comprehending these complex illnesses. The pathogenesis of autoimmune diseases involves both humoral, antibody-mediated, and cell-mediated immune responses against self-antigens. For example, in rheumatoid arthritis, autoantibodies attack joint tissues, leading to chronic inflammation and destruction. In type 1 diabetes, T-cells destroy insulin-producing beta cells in the pancreas. The immune system's failure to regulate itself can lead to a vicious cycle of inflammation and tissue destruction. Diagnosis often involves identifying specific autoantibodies and clinical symptoms. Pathophysiology explores the intricate mechanisms by which self-tolerance is lost and how these misguided immune attacks lead to specific disease pathologies, guiding therapeutic strategies. Immunodeficiency syndromes. Immunodeficiency syndromes are conditions in which the immune system's ability to fight infectious diseases and cancer is compromised or absent. These disorders can be primary, congenital or inherited, or secondary, acquired later in life. Primary immunodeficiencies are typically genetic defects affecting the development or function of immune cells, leading to recurrent, severe, or unusual infections. Secondary immunodeficiencies are more common and can result from various factors such as malnutrition, infections, for example HIV, immunosuppressive drugs, radiation therapy, or certain cancers. Understanding the specific defect in the immune system is critical for diagnosis and management. The clinical manifestations of immunodeficiency vary widely depending on which part of the immune system is affected. Defects in humoral immunity, B cells and antibodies, often lead to recurrent bacterial infections, while defects in cellular immunity, T cells, predispose individuals to viral, fungal, and opportunistic infections. Combined immunodeficiencies affect both branches and are often the most severe. Pathophysiology explores how these specific immune defects lead to increased susceptibility to particular types of pathogens and the development of chronic or life-threatening infections. Management often involves prophylactic antibiotics, immunoglobulin replacement therapy, or stem cell transplantation, depending on the underlying cause. Neoplasia. Basic concepts. Neoplasia, commonly known as cancer, refers to new, abnormal growth of cells that is uncontrolled and progressive. It is characterized by cells that have lost their normal regulatory controls over growth and differentiation. Neoplasms can be benign or malignant. Benign tumors are localized, grow slowly, and typically do not spread to other parts of the body, usually posing little threat unless they compress vital structures. Malignant tumors, or cancers, are invasive, grow rapidly, and have the ability to metastasize, spreading to distant sites and forming secondary tumors. Understanding this fundamental distinction is crucial for diagnosis and prognosis. The development of neoplasia is a multi-step process involving genetic mutations that affect key regulatory genes, including proto-oncogenes, tumor suppressor genes, and genes involved in DNA repair. These mutations lead to hallmarks of cancer, such as sustained proliferative signaling, evasion of growth suppressors, resistance to cell death, limitless replicative potential, induced angiogenesis, and activation of invasion and metastasis. Pathophysiology explores how these genetic alterations accumulate over time, transforming normal cells into cancerous ones. The study of these basic concepts provides the foundation for understanding cancer biology and developing effective treatments. Tumor growth and metastasis. Tumor growth refers to the expansion of a neoplastic mass driven by uncontrolled cell proliferation. For a tumor to grow beyond a few millimeters, it requires its own blood supply, a process known as angiogenesis. Tumor cells secrete growth factors that stimulate the formation of new blood vessels from pre-existing ones, providing essential nutrients and oxygen for continued growth. The rate of tumor growth can vary widely depending on the type of cancer and its biological characteristics. Understanding the mechanisms of tumor growth, particularly angiogenesis, is crucial for developing anti-cancer therapies that target the tumor's blood supply. This process is a hallmark of aggressive cancers. Metastasis is the process by which malignant tumor cells spread from the primary site to distant organs, forming secondary tumors. It is the most common cause of cancer-related mortality. The metastatic cascade involves several steps: local invasion of surrounding tissues, intravasation into blood or lymphatic vessels, survival in the circulation, extravasation from the vessels at a distant site, and colonization of the new tissue. Not all tumor cells that enter the circulation successfully establish secondary tumors. Only a small fraction complete the entire cascade. Pathophysiology explores the complex molecular and cellular interactions that enable tumor cells to acquire metastatic potential, a critical area for cancer research and treatment. Genetic basis of disease. Many diseases have a genetic component, meaning they are caused or influenced by alterations in an individual's DNA. These genetic abnormalities can range from single gene mutations to large-scale chromosomal aberrations. Genetic diseases can be inherited from parents or acquired during a person's lifetime due to environmental factors or errors in DNA replication. Understanding the genetic basis of disease is fundamental to modern medicine, enabling genetic testing, counseling, and the development of gene therapies. It helps explain why some individuals are more susceptible to certain conditions and how diseases are passed through families. The field of medical genetics continues to expand rapidly. Genetic mutations can lead to disease by altering the structure or function of proteins, disrupting regulatory pathways, or affecting gene expression. For example, a mutation in a gene encoding an enzyme can lead to a metabolic disorder, while a mutation in a tumor suppressor gene can predispose an individual to cancer. The interplay between genetic factors and environmental influences is also crucial. An individual with a genetic predisposition may only develop a disease when exposed to specific environmental triggers. Pathophysiology explores how these genetic variations translate into cellular and physiological dysfunctions, ultimately leading to the clinical manifestations of disease. This understanding is key to personalized medicine. Chromosomal abnormalities. Chromosomal abnormalities are alterations in the number or structure of chromosomes, which can lead to a wide range of developmental disorders and diseases. These abnormalities can involve entire chromosomes or segments of chromosomes. Numerical abnormalities include aneuploidy, where there is an abnormal number of chromosomes, e.g., trisomy, monosomy, and polyploidy, where there are extra sets of chromosomes. Structural abnormalities involve changes within a chromosome, such as deletions, duplications, inversions, or translocations. These changes often arise during gamete formation or early embryonic development. Understanding these large-scale genetic errors is critical for prenatal diagnosis and genetic counseling. The clinical consequences of chromosomal abnormalities vary greatly depending on the specific chromosome involved and the extent of the alteration. For example, trisomy 21, Down syndrome, is caused by an extra copy of chromosome 21, leading to characteristic physical features, intellectual disability, and increased risk of certain health problems. Other syndromes, like Turner syndrome, monosomy X, or Klinefelter syndrome, XXY, affect sex chromosomes and result in distinct developmental and reproductive issues. Pathophysiology explores how these imbalances in genetic material disrupt gene dosage and developmental pathways, leading to the observed phenotypic features and health complications. Genetic testing is essential for identifying these conditions. Single gene disorders. Single gene disorders, also known as Mendelian disorders, are caused by mutations in a single gene. These disorders follow predictable inheritance patterns: autosomal dominant, autosomal recessive, or X-linked. Autosomal dominant disorders require only one copy of the mutated gene for the disease to manifest, such as Huntington's disease. Autosomal recessive disorders require two copies of the mutated gene, one from each parent, for the disease to appear, like cystic fibrosis. X-linked disorders are caused by mutations on the X chromosome, often affecting males more severely, such as Duchenne muscular dystrophy. Understanding these patterns is crucial for genetic counseling and risk assessment. The pathophysiology of single gene disorders involves the defective gene leading to the production of an abnormal protein, a reduced amount of a normal protein, or no protein at all. This protein dysfunction then disrupts specific cellular or physiological processes, leading to the clinical symptoms of the disease. For example, in cystic fibrosis, a mutation in the CFTR gene leads to a defective chloride channel, causing thick, sticky mucus in various organs. In sickle cell anemia, a single point mutation in the beta-globin gene results in abnormal hemoglobin, leading to red blood cell sickling. Pathophysiology elucidates the precise molecular mechanisms by which these single gene defects cause widespread systemic effects, guiding targeted therapies. Cardiovascular pathophysiology. Cardiovascular diseases, CVDs, are a group of disorders affecting the heart and blood vessels, representing a leading cause of morbidity and mortality worldwide. Pathophysiology of CVDs often involves a complex interplay of genetic predispositions, lifestyle factors, and environmental influences. Key conditions include hypertension, high blood pressure, atherosclerosis, hardening of the arteries, coronary artery disease, heart failure, and arrhythmias. Understanding the underlying mechanisms of these conditions is crucial for effective prevention, diagnosis, and management. The cardiovascular system's intricate network makes it susceptible to various forms of dysfunction. Hypertension is characterized by persistently elevated blood pressure, which can damage blood vessels and organs over time. Its pathophysiology involves dysregulation of blood volume, vascular tone, and the renin-angiotensin-aldosterone system. Atherosclerosis is a chronic inflammatory disease characterized by the buildup of plaque within arterial walls, leading to narrowing and hardening of the arteries. This process begins with endothelial injury and involves lipid accumulation, immune cell infiltration, and smooth muscle cell proliferation. These conditions often coexist and contribute to each other's progression, forming a dangerous cycle of cardiovascular compromise. Pathophysiology details how these processes lead to clinical events like heart attacks and strokes. Respiratory pathophysiology. Respiratory diseases affect the airways, lungs, and associated structures, impairing the body's ability to exchange oxygen and carbon dioxide. These conditions can range from acute infections to chronic debilitating illnesses. Common respiratory conditions include asthma, chronic obstructive pulmonary disease, COPD, pneumonia, and cystic fibrosis. The pathophysiology often involves inflammation, airway obstruction, destruction of lung tissue, or impaired gas exchange. Understanding these mechanisms is essential for diagnosing and managing respiratory distress and improving patient outcomes. The delicate structure of the lungs makes them vulnerable to various environmental and internal insults. Asthma is a chronic inflammatory disorder of the airways characterized by reversible airway obstruction, bronchial hyperresponsiveness, and recurrent episodes of wheezing, breathlessness, chest tightness, and coughing. Its pathophysiology involves immune cell activation, mediator release, bronchoconstriction, and mucus hypersecretion. COPD, encompassing chronic bronchitis and emphysema, is characterized by persistent airflow limitation that is usually progressive and associated with an enhanced chronic inflammatory response in the airways and lungs, primarily caused by noxious particles or gases, most commonly cigarette smoke. Emphysema involves destruction of alveolar walls, while chronic bronchitis involves mucus hypersecretion and small airway fibrosis. Pathophysiology differentiates these conditions by their specific structural and functional changes. Renal pathophysiology. Renal diseases affect the kidneys, impairing their vital functions of filtering waste products from the blood, regulating fluid and electrolyte balance, and producing hormones. Kidney dysfunction can range from acute, sudden loss of function to chronic, progressive decline. Common renal conditions include acute kidney injury, AKI, chronic kidney disease, CKD, glomerulonephritis, and urinary tract infections. The pathophysiology often involves damage to the nephrons, the functional units of the kidney, leading to impaired filtration, reabsorption, and secretion. Understanding these mechanisms is critical for preventing kidney failure and managing its complications. The kidney's complex filtration system is susceptible to various insults. Acute kidney injury, AKI, is characterized by a rapid decrease in kidney function, often reversible, leading to accumulation of waste products. Its pathophysiology can be pre-renal, decreased blood flow to kidneys, intrinsic, damage to kidney structures, or post-renal, obstruction of urine outflow. Chronic kidney disease, CKD, is a progressive, irreversible loss of kidney function over months or years, often leading to end-stage renal disease. The pathophysiology of CKD involves persistent inflammation, fibrosis, and loss of nephrons, regardless of the initial cause. This leads to a gradual decline in glomerular filtration rate and systemic complications. Pathophysiology differentiates these conditions by their onset, reversibility, and specific cellular damage patterns. Endocrine pathophysiology. Endocrine diseases result from dysfunctions in the endocrine system, which comprises glands that produce and secrete hormones directly into the bloodstream. These hormones regulate nearly every physiological process, including metabolism, growth, reproduction, and mood. Endocrine disorders can arise from hormone overproduction, hyperfunction, underproduction, hyperfunction, or abnormal tissue response to hormones. Common conditions include diabetes mellitus, thyroid disorders, and adrenal gland disorders. Understanding the intricate feedback loops and cellular signaling pathways involved in hormone regulation is crucial for diagnosing and managing these complex diseases. The precise balance of hormones is vital for maintaining homeostasis. Diabetes mellitus is a group of metabolic disorders characterized by hyperglycemia, high blood glucose levels, resulting from defects in insulin secretion, insulin action, or both. Type 1 diabetes involves autoimmune destruction of insulin-producing beta cells in the pancreas, leading to absolute insulin deficiency. Type 2 diabetes, far more common, is characterized by insulin resistance, cells not responding properly to insulin, and a relative insulin deficiency. Both types lead to chronic complications affecting the eyes, kidneys, nerves, and cardiovascular system. Pathophysiology explores how these defects in insulin production or action disrupt glucose metabolism, leading to widespread systemic effects and long-term organ damage. Neurological pathophysiology. Neurological diseases affect the brain, spinal cord, and nerves, leading to a wide range of sensory, motor, and cognitive impairments. These conditions can result from various etiologies, including vascular events, neurodegeneration, trauma, infections, and genetic factors. Common neurological disorders include stroke, Alzheimer's disease, Parkinson's disease, and multiple sclerosis. The pathophysiology often involves neuronal damage or death, disruption of neurotransmission, or demyelination. Understanding these complex mechanisms is crucial for developing effective treatments and improving the quality of life for affected individuals. The brain's intricate network makes it particularly vulnerable to dysfunction. Stroke occurs when blood flow to a part of the brain is interrupted, either by a blockage, ischemic stroke, or rupture of a blood vessel, hemorrhagic stroke, leading to brain cell death. Its pathophysiology involves excitotoxicity, inflammation, and oxidative stress in the affected brain tissue. Alzheimer's disease is a progressive neurodegenerative disorder characterized by the accumulation of amyloid plaques and neurofibrillary tangles in the brain, leading to neuronal loss and cognitive decline. Both conditions result in significant functional impairment and highlight the vulnerability of brain tissue to various insults. Pathophysiology details how these specific processes lead to the observed neurological deficits. Gastrointestinal pathophysiology. Gastrointestinal (GI) diseases affect the digestive tract, from the esophagus to the anus, and associated organs like the liver and pancreas. These conditions can impair digestion, nutrient absorption, and waste elimination, leading to a variety of symptoms. Common GI disorders include inflammatory bowel disease, IBD, peptic ulcer disease, gastroesophageal reflux disease, GERD, and liver cirrhosis. The pathophysiology often involves inflammation, structural damage, motility disorders, or impaired secretion, absorption. Understanding these mechanisms is crucial for effective diagnosis, treatment, and management of digestive health. The GI tract's extensive surface area and complex microbiome make it susceptible to various insults. Inflammatory bowel disease, IBD, encompassing Crohn's disease and ulcerative colitis, is characterized by chronic inflammation of the GI tract. Crohn's disease can affect any part of the digestive tract, often with skip lesions and transmural inflammation, while ulcerative colitis primarily affects the colon and rectum, with superficial inflammation. The pathophysiology involves a complex interplay of genetic susceptibility, dysregulated immune responses to gut microbiota, and environmental factors. This chronic inflammation leads to tissue damage, ulceration, and symptoms like abdominal pain, diarrhea, and weight loss. Pathophysiology explores how this immune dysregulation in the gut leads to specific patterns of inflammation and tissue destruction, guiding therapeutic strategies.